What's the difference between a bone-anchored hearing aid, or Baha, and a traditional hearing aid, and how do these devices help you hear your best? In this video, I'll discuss these two types of hearing device technology. Hi, I'm Dr. Derek, audiologist, audio engineer, and musician with ProFitHearing.com. If you have concerns about your hearing, always consult with your local physician or audiologist. When we have hearing loss, we experience reduced hearing sensitivity for different frequencies or pitches. So for example, if we have a high frequency hearing loss, that impacts our ability to hear the consonants in speech. This reduces the speech clarity and it makes it more difficult to understand what someone's saying, especially in background noise. One type of hearing device technology is a Baha, or bone-anchored hearing aid. It's used to treat conductive hearing loss, mixed hearing loss, and single-sided deafness. Conductive hearing loss is when sound cannot travel down into the ear canal normally. This can be caused by problems with the eardrum, middle ear cavity, the bones inside the ear, or a narrowing or absence of an ear canal. Mixed hearing loss is a combination of sensorineural and conductive hearing loss, and single-sided deafness is profound hearing loss on one side. A Baha uses bone-conducted sound. The microphones on the Baha pick up the sounds around you, process the sound, and then amplify the sounds to accommodate hearing loss. The amplified sound is then transferred to the inner ear through the skull as the Baha vibrates against the head. A bone-anchored hearing aid can be held into place behind the affected ear with a soft band, which is common with children, a sound arc headband, or it can be surgically connected to the skull. One possible surgical approach is to use an abutment or metal post inserted into the skull. The Baha device is then attached to the post. Another solution uses an implant under the skin. A sound processor device is placed behind the ear or on the head. This sound processor connects to the implant under the skin via a coil of wire and a magnet. A second type of hearing device technology is a hearing aid. A hearing aid uses air-conducted sound. It does not use bone conduction, nor does it include possible surgery like a bone-anchored hearing aid. Hearing aids fit either inside the ear or behind the ear. A hearing aid also uses microphones to pick up the sounds in your environment. The computer chip inside the hearing aid processes the sound so that the background noise is reduced and the speech sounds are amplified. This improves your speech audibility and clarity for improved communication. Why would you use a bone-anchored hearing aid over a traditional hearing aid, or vice versa? First, consult with your local audiologist or physician to determine if either device is appropriate for your specific needs. Generally, a Baha can help improve hearing for ears that do not have an ear canal or won't accommodate a traditional hearing aid. Your audiologist or physician can review your history and test results to help you determine the best solution. If you like this video, please hit the like button and let me know what questions you have in the comments below. To learn more about today's latest hearing aids, headphones, and audio technology, click or tap the screen. Thanks for watching, and I'll see you in the next video.